to be there. The care that they were providing was really good, from what I could tell, not being a medical professional. There were a lot of them in there. They were well staffed. But several of the people, in fact, I met one woman who said, I've been sick twice. I think it was COVID, and I just came back from my second stint of being sick. One of the doctors, the emergency room doctor, critical care doctor we talked to, went home, and he said, this was last week, he said, I was out for 5 days. He goes, I think I definitely had it. They are exposed to it every single day. And I just want to remind you that every one of these people is alone. There are no visitors. They recover and get better alone, or they die alone. 80% of the patients, 80% of the patients at Brooklyn Medical Center have COVID-19. And with that, I'd like to bring in Dr. Jon Santiago. He is a doctor in Boston. He is also a representative in the area. If he is on right now, I'm not seeing him. So, John, if you are watching this, for whatever reason, I do not see your account. So if you're on, why don't you just type a comment below that says, hi, David, it's John, I'm here. And I can go ahead and bring you in. But as of right now, I'm not seeing your account on here. Jon Santiago is an emergency room doctor, but he's also a state legislator. So he's got a unique perspective of being a caretaker, but a policy maker. And that's why I wanted to bring him in to talk a little bit about that. So here he says he is. So we'll bring him in. Hello, John.
Hey, Dave, how are you?
Good. Thanks for joining us tonight.
Of course.
So I just said to everyone, you're a doctor. You are also serving your first term in the state legislature. And I was struck by an article that I read in a comment that you gave to, I believe, the Boston Globe, where you have a real passion in helping people who are homeless, right? And so you're a caretaker and a policymaker. And one of the things you said in the Globe was, how do you tell a homeless person to socially distance? How do you tell them to go home and stay home? Yeah. Tell us a little bit more about that.
Well, I mean, long before the situation that we see today has arrived, we knew what was going to happen. Oftentimes when we have a tragedy that strikes our country, our city, our state, we know that those communities and those populations that are most vulnerable will be hit the hardest. And so a couple of weeks ago, I wrote an op-ed about this, and really putting on my state representative to see what we can do just to make sure that when we talk about recovery, relief, support for these communities, that we keep them in mind, because they're so often forgotten about. Never mind if there's a epidemic going on. And so in that article that piece that I had written, I spoke about homeless patients. I spoke about people who are housing insecure, undocumented immigrants. I mean, how do we make sure that they're secure enough and they feel safe enough to come to the hospital and to receive care? And I'm very proud of the fact that I work at Boston Medical Center, and it's a safety net hospital in Boston. It's the busiest emergency room in New England, and that we really, we cater to these communities. We try to provide culturally competent care. But in this particular situation, when we know that quarantining and adequate medical care is what they need, just making sure that they get the care that they deserve.
John, tell us some of those frontline stories that you have experienced so far working in the ER with COVID.
So it's been fascinating, and obviously it's tragic. I think we are in the beginning of a marathon that I'm not so sure has started yet. Obviously it started in New York, but across the country, it's going to get worse before it gets better. And I've had an interesting perspective, not just as a state rep. So during the week, I kind of donned my state rep hat, and I've been on the phone with colleagues, state house folks, the media, what have you, talking about what policies that we need to introduce or pass to really make sure that our constituents are taken care of. But I've been working every weekend, Friday, Saturday, and Sunday over the past month, and every weekend there's been a new issue or theme that has arisen. And I remember 4 weeks ago, maybe 4 or 5 weeks ago, when we weren't too concerned about it, we weren't talking about it as much. The following week, there was this whole bonanza about testing. And I remember coming to the emergency department, working Friday, Saturday, and Sunday. And the testing protocols with protocols to better address what we were doing. I'll give you an example with respect to homeless people. It was about 3 o'clock in the morning 3 weeks ago where I was checking my email, and I learned that the shelters were not accepting homeless patients if they had symptoms. And if you've worked with the homeless population before, I mean, a lot of them have smoker's cough, a lot of them were sick, have chronic illnesses. And so here I am at 3 in the morning, having to figure out what do I do. So I started to admit them all. It was kind of a crazy shift, obviously, but the next week, luckily the city of Boston, working with shelters and working with nonprofits, were able to set up tents outside, makeshift hospitals to really put these people in. And over the course of the past week, the city's done a lot to make sure that these communities are going to be taken care of. I mean, we have a lot to do, but I think we're heading in the right direction.
Can you hear me? Your Wi-Fi is breaking up a bit. You there?
Yeah, I'm here. Can you hear me?
Yeah, I hear you. So the tents that y'all were setting up outside the hospital, are those specific to people who are homeless?
Absolutely. So we have so where Boston Medical Center is located, it's between some of the largest shelters in the state, including this nonprofit that is Boston Healthcare for the Homeless, which does God's work. And so working with these partners, we were able to set up these tents. One would be COVID positive people. One would be COVID people under suspicion of having COVID. And so I would see them in the emergency room, then I would send them over there. And depending on what their test was, they would be able to quarantine.
That's incredible, because it's like you said, even if they were good enough to go home, right, and they came in with mild symptoms, where are you going to send the contagious person home to? You're just sending them contagious, spewing viral load into the community.
That's absolutely right. And the tricky thing about this disease, I mean, it's quite insidious. So I just did a post last night talking about, I went in the hospital to finish up my notes from the past week, and there were a couple of patients where I didn't really suspect had COVID, but you have to have a high degree of suspicion because not everyone presents the same. Not everyone has fevers, chills, cough.
Right.
I had an older man. He was like in his 60s. His only symptom was that he got up in the middle of the night, went to the restroom, and passed out, which is a common thing in the emergency department. Oh, you syncopized, you passed out, and you're up, and we admit you for a day or so. But he had COVID. I had an older woman with diarrhea, and she had COVID. And so this presents challenges. I mean, because if you admit these people to the regular floor, they could potentially infect the healthcare workforce who are not dressed up, or the other patients.
And John, not to mention, you don't don a COVID protective outfit when a woman with diarrhea walks in the ER.
You nailed it. Now, I mean, I wear masks now for everyone.
Right.
Yeah. And you have some cases where patients come in terribly sick. For example, you'll have a rollover accident. This was 2 weeks ago. This guy came in very sick, broken bones, what have you. The trauma team's involved. Things got to move quick and fast in order to save a life. And then you do the CAT scan to make sure, no internal organs are have issues, or no broken bones. And you see the ground glass opacities that people often talk about on CTs. And you're asking yourself, wait a second, did this person have COVID? Did I just infect